Go.
Good afternoon. My name is Jean Barusso. I am the CEO and Chairman of the World Council on Prevention and Sustainable Health. It's a great privilege for me to introduce our organization and our partners in this World Innovation Summit for Health in Doha. First, I would like to thank the government of Qatar, the Ministry of Health, the Qatar Foundation, and WISH for inviting us to the summit. I am also very grateful to the organizer of the summit, and in particular, Mrs. Sultana Afdal, CEO of WISH, and Mr. Neil Moores, Head of Community Development, for their help in making our participation to the agenda a reality. Secondly, I will introduce briefly our organization, known as the World Council on Prevention and Sustainable Health, and its goals. Our motivation can be resumed in this statement. Prevention is no longer an option in this world, but a necessity, and it is time to be concrete and effective. Now, I would like to remind you that, according to the recent WHO and OECD data, the economic cost of treating chronic diseases and mental health illnesses will be exorbitant if no action is taken on prevention. Moreover, statistics and analysis show that 60% of premature deaths, including cancers and cardiovascular mortalities, are mainly the result of bad habits in our modern lifestyle. Our organization was created to lead a paradigm shift upstream in the general worldwide medical approach. Therefore, our main objective is to consolidate a cluster of scientific thinkers and private innovation actors to promote the well-being of everyone, notwithstanding age categories, to develop initiatives in education and health prevention, and to fight main chronic health problems, and of course, to reduce medical pressure and cost, public or private, by developing accurate and prevention measures upstream instead of only curing disease. In this summit, we will present you the main core of the WCPSH, known as, first, the International Share of Cardiometabolic Risk, or ICCR, which regroups international academic specialists from all over the world. Secondly, the Corporate Challenge, a leading Canadian organization in health education and health evaluation through specialized mobile units for accurate diagnosis. And finally, Diamantis, a worldwide leader in mental health, which developed accurate diagnosis for early prevention of mental diseases. After this brief introduction, it is now my pleasure to introduce you to our three main speakers for this forum. First, Mr. Jean-Claude Coubard, my Vice President of the organization. He will give you more details about the World Council for Prevention and Sustainable Health organization, and will also describe the role of ICCR. Secondly, Mrs. Nataliya Naha, PhD, Assistant Professor and Researcher for the Cardiology and Pneumology Institute at Laval University in Quebec City, Canada. She is also head of the health program at the Corporate Challenge. In her communication, she will explain the pragmatic solution in health preventions. And finally, Mr. Bernard Guimond, Vice President of Diamantis and Chief Corporate Developer Officer. He will discuss about the innovative system developed by Diamantis in prevention and diagnosis of mental illnesses. Finally, I would like to remind you all that each of us is an actor in our own health. Therefore, we must propose pragmatic and attractive solutions to attract people and encourage them to get involved in health prevention. It is our responsibility to act and implement. First, with the urgent health prevention needs, we have created the organization to provide solutions to health problems worldwide. We cannot wait any longer. Our axis of development is to bring pragmatic solutions in prevention as well as sustainable health. We are particularly pleased with Qatar's position on the subject. Its vision clearly shows willingness to enter in the construction of a future-oriented and prevention-oriented society. One of their achievements is, no doubt, to have scheduled this important World Innovation Summit for Health. As our summit host, every nation has a role to play in building a society based on a pragmatic approach to prevention. It is why our vision and mission is to establish satellite clusters, to extend our model around the world, and to implement proximity solutions focusing on prevention. Thank you for your attention. And now Mr. Kuba will follow with his presentation of the organization, the World Sustainable Prevention and Sustainable Health.
Thank you, Jean. And my name is Jean-Claude Kuba. I'm the Vice President of the World Council on Prevention and Sustainable Health. And before introducing our organization, I'd like really to warmly thank Sultana Agdal, as well as Neil Moore and their team for organizing this meeting in a very period due to the COVID-19. So thank you to them and to their work. The World Council on Prevention and Sustainable Health is global. We really want a healthier world for today and for the future generation. In order to achieve this goal, we need really to build a global organization on prevention and sustainable development. So I will answer now to the following question: who we are and what is our vision and our mission. If I can have the first slide. As you will see next, the World Council on Prevention and Sustainable Health is really an independent, non-activist and non-political organization. This means that we are an inclusive organization. The object, can I have the
presentation? Yeah. Continue, Jean-Claude. Ouais.
Okay. The objective of the WCPSH is to support any initiative and sustainable health development in order to maintain a sustainable and robust economy. In this sense, health is not only a sense of well-being, the economic aspect is also important. The economy depends on the health of the population, and health depends on the economy. It's both sides. So the scientific literature since years have really shown that prevention is a key important model to develop worldwide. We really want to translate the strong scientific evidences we have since years into public health program, into prevention program. That's really why we have created the WCPSH 18 months ago. So the observation is that the academic world is developing very interesting scientific data, but this data is not transformed into a pragmatic approach with active solution and affordable solution. As you will see in the next two presentations, our key wording is really active prevention, prevention, prevention. It's our leitmotif. So that's why we have created
Dr. Jean-Claude, sorry to interrupt you. Dr. Jean-Claude, sorry, but the slides are not on, so...
Okay. We have a technical problem here, I'm sorry.
Can we please try once
Jean-Claude, mets la tienne.
Mets la tienne, Jean-Claude.
Pardon?
Si tu es capable de mettre la tienne, s'il te plaît.
Ah ben non, je ne l'ai pas préparé là. Je ne l'ai pas préparé en backup. Donc...
So you can continue and I'll try to put it on anyway.
On n'apportera pas après.
Ouais.
Là, je la vois sur le bureau.
Okay, you can continue, Jean-Claude, and I'll try to put it on, okay?
Okay. So maybe I can introduce you now the International Chair on Cardiometabolic Risk. You can ask why, because I was the past executive director of the International Chair on Cardiometabolic Risk, which is based at Université Laval in Quebec. And I'd like also to thank warmly Professor Jean-Pierre Després, a world leader in obesity, in particular abdominal obesity, who leads scientifically this organization that we have created 15 years ago. So the ICR is a group of 30 scientific experts from 5 different disciplines, and the objective of this international academic organization is education program and scientific exchanges with the tools that we have established and which is common in health, which are conferences, preceptorship, publications, and website. So this organization works since 15 years already said, and we also organize our own international congresses to really transmit our messages, which is changing behavior, changing lifestyle is the key words to change, to fight this epidemic of obesity and chronic societal disease in the world. So that's why this ICCR is very important in terms of education for the medical community, in terms of information for the public, and we also work with all the tools we have in hand now, which are the social media, web portal, and we also try to be a reference in terms of science for the other organization. We have collaboration with other academic societies such as EHA, ADA, SEC, in Europe, the European Society of Cardiology, the European Society of Diabetes, and so on. So we are here with the ICCR to really help to translate the scientific evidences into public health education program. That's why the ICCR has joined the World Council on Prevention and Sustainable Health. And maybe to keep on time, I'd like now to move on Nathalie Almeras, who will introduce you her organization. Nathalie, if you wish, can you start? Your screen, ton micro. You are on mute.
Yes, I just want to be sure that, I'm sorry. It's technology.
Or you can leave.
Sorry about that. Thank you to the organizers for allowing me to allowing us to present the initiatives of the Great Challenge for the World at the World Innovative Summit of Health. I am Nataliya Naha, scientific advisor for the Great Challenge and researcher at Laval University in Quebec, Canada. As mentioned by Jean-Claude Coubard and Jean Barusso, type 2 diabetes, hypertension, and cardiovascular disease are very prevalent health conditions with personal and societal consequences.
T'es pas sur mute, Nathalie?
Non, on m'entend pas?
Okay, c'est bon.
It's okay?
Yeah.
Okay. Now the science is clear. These costly chronic diseases are largely caused by poor lifestyle habits, and concrete action must be taken to bring prevention solutions to the adults, children, and families. 12 years ago, I had the chance to meet two dynamic, inspiring, and mobilizing entrepreneurs, Pierre Lavoie and Germain Thibault, who have built the Great Challenge. Their ultimate goal to create a culture of preventive health in Quebec and outside by leading people to adopt healthy lifestyle habits. To achieve their goal of prevention, they have brought together imagination, technology, science, and mobilization. 2 mobile units have been built that go out to meet people where they live. For elementary school children, an interactive educational unit, Eat Better and Move More. And for the workplaces, a mobile cardio-metabolic and cardio-respiratory health assessment unit to bring to them a health and wellness program. Let me introduce you briefly the interactive education unit. The unit was developed around the theme of life in space. The theme of space is perfect to capture the attention of the young and the not so young. The ultimate message to bring home, their body is like a spaceship. As long as they take good care of it, it can take them as far as they can dream. The interactive educational units is composed of 2 workshops, Eat Better and Move More. Each workshop can accommodate a class of 26 students. The Eat Better workshop consists of 3 stations. At the food sorting station, kids play on giant Microsoft surfaces. They select food items on the conveyor belts and drag them into the categories to which they belong: vegetables and fruits, protein foods, and whole grain foods. Some processed foods are hiding among them and must be identified. Misclassified food will be presented again to child until they are properly classified. At the meal prep station, using augmented reality, children select foods, compose their plate, and validate their choices. The interaction game helps them identify processed foods that should be avoided and missing categories for food items that should be eaten daily. At the Drink Choices station, kids will play at a quiz. The drink choices will appear on the iPads, and with their teammates, they will have to find best choices using the labels, the ingredient list, the drink names, and the nutritional claims. They will learn how the marketing wants them to believe that the drinks they are selling are good for them. Now the Move More workshop is housed in a trailer design with 2 mezzanine-style extensions. The training module is equipped with 26 stationary bikes adapted for kids. A personalized experience is offered to each user respecting their abilities. They will cross 6 different virtual environments, such as desert space, imaginary forest, cave, roller coaster, streets, and bridges. Kids will experience and enjoy the feeling of moderate and vigorous.
Nathalie, sorry to interrupt you, but the slides are not moving.
Unit will last about 1 hour.
It's just the same slide.
Talk about adults.
Okay, thank you.
Mobile
Sorry.
cardio-metabolic and cardio-respiratory health assessment unit is the heart of the Great Corporate Challenge, a health and wellness program designed for the workplace. Its mission is to mobilize employees around their overall health and help them adopt healthy lifestyle. The Great Corporate Challenge wants to give employees a taste of benefit of physically active lifestyle, as well as the benefit of a healthy diet and a tobacco-free lifestyle. The mobile health unit was developed with a recreational vehicle fit out as a mobile medical clinic. This unit is made up of 6 stations, which are all networked. At the beginning of the experience, participants will have an iPad on which they will answer several questionnaires to get the information about their socio-demographic characteristics, family history, medical history, smoking habits, physical activity habits, and nutritional qualities habits. Those questionnaires are validated questionnaires. They will have, after this little period of rest, they will have their blood pressure taken. They'll then go to the anthropometric station, where they'll have their height and weights, but also their waist circumference, which is an indicator of abdominal obesity, which is the biggest enemies for all those chronic health diseases. Then they'll have their blood sample taken, and the blood sample will be processed on our little laboratory that we have right on the spot. And then during that time, they will go for their physical activity. But let's make a tour inside of this metabolic health unit. Here we have a view from the front of the unit. The assessment starts with the computerized questionnaire, as I just said. All responses are recorded and ready to be interpreted. Down the aisle at the right, we have the anthropometric station that I also just talked about. And at the back, you will find the blood sample stations and then the laboratory. The registered nurse will perform the blood sample, and the sample will be immediately treated by the medical technologist. In the laboratory station, we have 5 robots, 3 Piccolo, that's their name, that measure the basic lipid profile, and 2 DCA for the measurements of HbA1c, which provide the information on diabetes or impaired glucose. A total of about 10 minutes is required to obtain the results for a participant. These results are automatically saved in the participant electronic file. During those 10 minutes, which is required for the laboratory assessment, the participant will be submitted to a submaximal treadmill test in the other part of the unit. This test will allow to evaluate response to exercise, heart rate, blood pressure, as well as to obtain the estimated VO2 max, which will be a great indicator for this cardiorespiratory fitness. We have then the consultation stations that will allow healthcare professional to present and explain a personalized detailed report immediately after the completion of the assessments. This report will provide references value for age and sex, as well as personalized lifestyle recommendation to choose from to start their lifestyle habits modification period. The program, the intervention. The whole evaluation takes about approximately 75 minutes, including the explanation of the personalized report. On a typical day, more than 65 employees can be assessed. We have in our database more than 5,000 participants that have participated. We have published 2 scientific articles in 2015 in the Medicine, Sports Science and Exercise, and in the Annals of Medicine. The science published provide valuable data on the convincing impact of the implementation of the Great Corporate Challenge in workplace. The main result obtained after the 3-month lifestyle modification program are comparable of the well-known diabetes prevention program, which is a 12-month lifestyle intervention program. We have observed a mean weight loss of 2 kilos, and more importantly, a decrease of 4 centimeters of waist circumference. As I just said, a simple clinical marker of abdominal obesity. It is important to underline that it has been demonstrated that a decrease of 4 centimeters of waist circumference decreased the risk of developing diabetes of about 60%. We also observed a 50% decrease in the prevalence of hypertension, and an absolute decrease of 0.7% of HbA1c, that indicator of diabetes. We also observed, which correspond to the this decrease of 0.7, correspond to the effect of 1 pill a day to treat diabetes, which is exercise, a good pill. These important health impacts were obtained with general improvement in lipid profile, increase in physical activity level, improvement in nutritional quality. And the improvement in cardiorespiratory fitness was also observed, which should be a vital sign for an ideal cardiovascular health. Furthermore, the Great Corporate Challenge allowed us at the Institute to create a unique database to further investigate the importance of lifestyle on cardiometabolic and cardiorespiratory risk profile. We have also published on the contribution of simple lifestyle risk score in the American Journal of Cardiology. More recently, in 2019, we have published on the contribution of nutritional quality on the cardiometabolic risk profile in the British Journal of Nutrition. And we have also documented in the American Journal of Hypertension the importance of submaximal response to exercise as an early sign of deterioration for the cardiometabolic profile. In conclusion, the mobile units make it possible to reach out throughout a large territory and to educate, mobilize, and give adults, children, and families the opportunity to take charge and take action. It was a pleasure to share with you this innovative initiative and to show that prevention through science, technology, and mobilization can bring the society for the benefit of health. Now, it is a pleasure to introduce Bernard Guimond from Diamantis, partners in the World Council of Prevention and Sustainable Health.
Thank you very much, Nathalie. First of all, we are sorry about the technical problem that we had occur so far. So the presentation will be available eventually, so you will be able to download them after. So thank you and good evening, ladies and gentlemen. I would like to present Diamantis. So just want to, is it on the screen? No, do you see it on the screen? No, okay, so sorry about that. So let me put it back on the screen. So, okay, so I'm not able to put it on the screen, and there's following that problem. So Diamantis offer a first diagnosis tool in mental health care that will allow clinicians to provide more accurate and earlier diagnosis in the disease process. A faster and more accurate diagnosis will allow the better support of the disease and consequently better therapeutic result and a reduction in cost. Schizophrenia, bipolarity disorder, and major depression affect almost 9% of the North American adult population, which means 25 million people in North America, but the same percentage could be worldwide on the same figure. Diamantis use a non-invasive test based on reliable analysis of information from ERG assessment biosignal. Diamantis is the first company to develop a software as a medical device, we call it SAMD, that measure information from a routine eye exam, electroretinography. Diamantis seek to empower physicians and transform mental health diagnosis, so its technology improve the standard of care and should be included in the treatment guideline. Diamantis is Laval University spin-off that have been done 5 years ago, and its team include experienced life science entrepreneur who helped create over $6 billion in market valuation in previous companies. Let me give you some figures that are quite important, and when we think about the COVID result is a problem that will occur in the next following years. 450 million people are affected by mental illness around the world. Only in United States, there's 28 million, patients that have a prescription about mental illness for an amount of $21 billion in 2015. A statistic that is quite amazing is on 911, 80% of the incoming calls are related to mental illness. in United States, 45,000 people died by suicide every year, which is more than car accident. In Canada, 500,000 people are away from their work weekly because of mental illness. So it is quite amazing to see those figures. And the problem is that everything is diagnosed by symptom and observation, and there's no tools to be able to diagnose the mental illness. Thomas Insel, which was the director of National Institute of Mental Health, was mentioning in 2015 that if you take all the disease on stroke, AIDS, heart disease, and so on, there were a reduction among the last 25 years about those disease. But the one that have not decreased at all is from the past 50 years is suicide. 90% of the suicide are related to mental illness. So the physician challenge is in different mental disease share the same manifestation, which can take up to 7 years before the patient is stabilized. If you, there's a lot of common space between different illness pathology, and this is why it's so difficult to be able to diagnose properly those disease. So it means that time is of the essence, and the more, the faster we're able and the earlier we're able to diagnose the illness, the better we can have an early diagnosis and is the traffic impact of mental illness by improving the medication selection and the promptness of the treatment. Our solution is to uncomplicated it as an electrocardiogram. We are using a non-invasive existing technology, deliver an earlier differential diagnosis for the most important mental illness that is fast, financially accessible, and precise and scalable. Our unfair advantage is, first of all, we have a solid proof of concept. At university, there were 1,000 subjects that had been diagnosed with the tool, and to 92% compared to the observation, which was at 50%. The first SAMD for mental disorder diagnosis and point of care tests to reach market before 2023. Third, a reliable and affordable services offered from one central database. And fourth, impressive symptomic efficient for physician, government, employees, and the payer. How do we generate the revenue? So the patient will have a consultation with his physician or the first line clinician or the psychiatric, which will refer to a hub or his own device in his cabinet and run what we call the ERG test to capture the data. From that, the data comes to Diamantis Analysis Center, and we do the interpretation, and it's sent back to the clinician that will receive and explain the diagnosis to the patient. The economic impact is huge. Identifying the right disorder will positively impact the lives of adolescents and young adults while limiting the weight of mental illness on the economy. We have to understand that the mental illness, 70% that the symptom will appear between the age of 15 to 25 years old. So this is our next generation. This is our workforce. And those people will have the illness very young in life compared to other illness, which is in cardiology or in diabetes and so on, which is much later that the symptom will appear. Be taken care very early. So what the economic impact will do is it will lift the productivity in business. It will increase the family revenues because we have to understand that family that are affected by a person that is have mental illness will have to support and take care of that person. Reduction of private and public healthcare costs, And of course, that will have an impact on drop in insurance company fees and the decrease of judicial, legal, and correctional spend. Our leading team is people that have been in the field of life science for over 25, 30 years. And people experienced like Mr. Tremblay, which is Normand, which is the CEO of the company, Dr. Claude Hariton, which is the Chief Scientific Officer. So we have a very high experienced team on board. So basically what Diamantis is looking for partnership to realize clinical study for schizophrenia, bipolarity, and deep depression, in line with medical and practice and regular affair in target countries. We have 10 sites running right now. We have sites in Montreal, in Toronto, Canada, and also Alberta. We have sites in New York and New Jersey, in Rochester, as well as McLean Hospital, which is Harvard, in Boston. So our technology is and a unique worldwide as a point of care. Thank you very much, and I will pass now to Mr. Baruso, which is will be the closing comments.
Thank you very much, Bernard. Now, if you have any question, we will be pleased to answer them briefly. Also, in the following list on the screen, we will bring a screen where you will find our team data to reach us after the summit for further discussions. Okay, thank you very much. It's open for the questions.
No question.
Tu as mis les data?
Did someone from Wish in the room? Bon, je crois qu'il n'y a personne. Hein. On a dépassé, on est à 54 minutes.
I don't know if the data appear on the screen.
So you can, yeah.
Someone
Just
from
a
Wish,
comment.
please?
We will send back the presentation in order to what we had explained during that 45 minutes, and we are again sorry about the technical problems that have been occurred, and we will submit to the all the presentation.
We are
had,
here, yes.
You're here?
And we'll
Oui, je suis là.
Thank you.
Jean-Claude, do you want to take the
Closing.
do you want to do the closing, Jean-Claude, or everything is
Rabi, tu es là?
Oui, je t'écoute. Je t'entends.
La session est finie, j'imagine.
they're
Il
still
y a 4 ou 5 minutes de plus. J'ai écrit sur le chat. Si vous aimez discuter encore, on a 5 minutes de plus.
Non, c'est gentil à toi, mais comment on peut rattraper ces problèmes techniques? Est-ce qu'on peut envoyer quelque part nos présentations, nos slides, ou est-ce que c'est perdu?
Pour le moment, c'est perdu, mais on peut le refaire peut-être après, car il faut fermer dans 3 ou 4 minutes. Désolé pour ça.
Oui, parce que c'est mis en ligne directement sur YouTube, hein, c'est ça?
Oui.
Ok,
Oui.
ouais.
Okay,
Bon, écoute, je reparlerai avec Neil, voir ce qu'on peut faire éventuellement, s'il est encore possible.
Oui.
Demandez l'adresse ou l'envoyer.
Oui,
Je vous laisse pour le moment pour fermer et on discutera après
oui, tout à fait.
comment récaper. Merci beaucoup.
Merci, désolé.